Good afternoon, guys. Now, this is a extension of yesterday's show, so we're going to discuss government benefits and cuts for disabled and seniors. Okay, so please join me for today's discussion for this. And this goes over a beautiful big bill where government is cutting funding for programs. So I'm going to go through that for everybody's FYI. So we'll go through that now. All right, we'll start. Big, beautiful bill. It's a sweeping legislative package that recently passed the U.S. House and now heads to the Senate for further debate and potential revisions. The bill includes major changes to Medicaid, SNAP, which is food stamps, guys, and tax policies with significant implications for different income groups. Okay, I'm going to go through those now. Key provisions in the bill: Medicaid and SNAP changes. Medicaid cuts. The bill proposes $625 billion in savings from Medicaid, which provides health insurance to over 71 million low-income Americans. These cuts could result in 7.6 million people losing coverage over the next decade. Work requirements. Adults enrolled in Medicaid expansion would face new work requirements and more frequent eligibility checks to remain in the program. Okay. Restrictions on clinics. Medicaid funding would be barred from clinics that perform abortions, such as Planned Parenthood. SNAP food benefits. SNAP is food stamps, guys. Changes. The bill tightens eligibility for food assistance, requiring work requirements for people aged 55 to 64, and limiting benefits to citizens and lawful permanent residents. State costs shifts. The bill shifts more of the SNAP program's costs to states, making a significant change in funding structure. Tax policy adjustments. Permanent tax cuts. The bill extends the 2017 Tax Cuts and Jobs Act, preventing tax rate increases for most income brackets. However, the benefits disproportionately favor wealthier Americans, of course. Child tax credit increase. Families would see an increase in child tax credit to 2,500 through 2028 before dropping to 2,000. No tax on tips and overtime. Taped employees and workers earning overtime wages would be exempt from federal taxes on these earnings until 2028. Okay, then there is car loan interest deduction. Buyers of American-made vehicles could temporarily deduct up to $10,000 in car loan interest payments. Other noticeable changes. Green energy rollbacks. The bill cuts several green energy tax credits and rescinds hold on, folks. Climate-related provisions from Biden's Inflation Reduction Act. Education and student loan. The bill increases taxes on private universities, endowments, boost funding for private schools, vouchers, and repeals Biden's era student loan relief programs. New savings accounts. Children under 8 years old would receive $1,000 for savings account, which could be used for education, home purchase, or business startups. The bill has sparked intense debate with supporters arguing it stimulates economy growth and reduces government spending, while critics warn it harms low-income Americans and prioritizes tax breaks for the wealthy. No shit. The Senate will now review and potentially modify the bill before it can become law. Okay, here's the question. Here's question 1, guys. Would you like to delve deeper into a specific area? Okay, and then we go into Medicaid cuts. Okay, the bill could significantly could have consequences for low-income Americans, especially those who rely on the program for healthcare access. Here is a breakdown of the key implications. Okay, number 1, millions could lose healthcare coverage. The bill proposes $625 billion in Medicaid cuts, which could result and 7.6 million people losing coverage over the next decade. Many low-income families, seniors, and individuals with disabilities depend on Medicaid for essential health care services, and losing access could lead to worse health outcomes. Next page. Okay. 2. Stricter eligibility and work requirements. Adults enrolled in Medicaid expansion would face new work requirements and more frequent eligibility checks. This means that individuals who struggle to find stable employment or experience temporary financial hardships could lose coverage. Families with children may also be affected if parents are unable to meet stricter requirements. 3. Limited access to essential clinics. Medicaid funding would be uh, barred from clinics that are barred from clinics that perform abortions, such as Planned Parenthood. This policy aims to prevent federal dollars from funding abortion services. Could also impact access to women's health care, cancer care. All right, let me get the page here. Cancer care screenings, birth control for low-income individuals. 4. Higher burden on hospitals and state budgets. State governments may need to fill the gap for people who lose Medicaid coverage, potentially leading to higher state taxes or budget shortfalls. Okay, then we go into hospitals and emergency rooms. Hospitals and emergency rooms could face overcrowded if more uninsured individuals rely on emergency care instead of regular doctor medical treatment. 5. Increased financial strain on low-income families. Without Medicaid, individuals may struggle to afford medical expenses, leading to, delays in seeking medical care, worsening health conditions, higher medical debt, pushing families into deeper financial hardship, reduced prescription drug access, affecting chronic illness management. Potential outcomes. Critics argue that these Medicaid cuts could widen health discrepancies and leave vulnerable communities without adequate care. Supporters, however, claim that the bill reduces government spending and encourages workforce participation. Would you like to delve deeper into how individual states may react to these cuts. Medicaid cuts in the bill could have serious consequences for mental health services, affecting millions of Americans who rely on Medicaid for therapy, medication, and crisis intervention. Key impacts on mental health services. Reduce access to therapy, counseling. Medicaid is the largest payer for mental health services in the U.S., covering therapy, case management, and crisis intervention. Cuts could lead to fewer therapists accepting Medicaid patients, increasing wait times, and reducing availability of care. Okay, two, increased mental health crisis. Many community health centers rely on Medicaid funding. Without it, crisis intervention programs may be scaled back or eliminated, forcing more people to seek emergency room care. In some areas, mental health crisis centers perform thousands of risk assessments annually, with over half of patients enrolled in Medicaid. 3. Strain on hospitals and emergency rooms. Without Medicaid coverage, more people experiencing mental health crisis may end up in emergency rooms, leading to overcrowding and higher costs for hospitals. Some states may reduce Medicaid reimbursement rates, making it harder for hospitals to provide mental health care. Okay, 4. Impact on schools and youth mental health. Schools receive Medicaid funding to support mental health services for students, including counseling and therapy. Cuts could mean fewer schools, psychologists, therapists, and mental health programs, affecting students with disabilities and behavioral health needs. 5. Loss of community-based programs. Many local mental health programs rely on Medicaid funding to provide substance abuse treatment, suicide prevention, and outpatient care. Cuts could force closures or reductions in services, leaving low-income individuals without affordable care options. Potential outcomes. Critics argue that these Medicaid cuts could worsen the mental health crisis, leaving vulnerable communities without adequate care. Supporters claim the bill reduces government spending, encourages workforce participation. Okay. And here's more question for you. Would you like to explore how individual states might respond to these cuts? Addressing mental health service cuts requires a combination of policy changes, funding strategies, and community based solutions. Here are some potential approaches: expanding Medicaid, a state level funding. Okay. States could increase Medicaid funding to compensate for federal cuts, ensuring continued access to mental health care services. Public private partnerships could help fund mental health programs, reducing reliance on government funding. Interesting. Strengthening community based mental health programs. Local mental health centers can expand services through grants and nonprofit funding. Peer support programs can provide low cost mental health assistance, reducing the burden on formal healthcare systems. 3. Advocating for federal policy changing. Restoring mental health parity laws would require insurers to cover mental health care at the same level as physical health care. Okay, then there's resigning federal funding for programs like substance abuse and mental health services administration could help sustain essential services. For increasing telehealth, digital mental health services. Teletherapy and online counseling can provide affordable and accessible mental health care, especially in rural areas. All driven mental health apps can offer self help tools and crisis intervention. 5. Expanding employer based mental health benefits. Workforce mental health programs could provide free counseling and therapy for employees. Tax incentives for businesses that offer mental health benefits could encourage wider adoption. Strengthening school-based mental health services. Schools can integrate mental health education into their curriculum to promote early intervention. Funding for school counselors and psychologists can help students access care without relying on Medicaid. Okay. Supporting nonprofit grassroots initiatives. Community-driven mental health programs can provide low-cost therapy and crisis intervention. Nonprofits can offer free or sliding scale services services to those affected by Medicaid cuts. The Medicaid cuts in the bill could have far-reaching consequences for society, affecting healthcare access, economic stability, and social equality. Here is a breakdown of the major implications. Worsening healthcare outcomes, millions losing coverage, meaning higher rates of untreated illnesses, leading to increased hospitalizations and preventable deaths. Mental health services would be severely impacted, increasing suicide rates, substance abuse, and homelessness. 2. Strain on hospitals and emergency rooms. Safety net hospitals that serve low-income communities could face financial collapse, leading to closure and reduced services. Emergency rooms would become overcrowded, and uninsured individuals seek care only in crisis situations. Economic and workforce challenges, job losses, healthcare, Medicaid cuts could lead to layoffs in hospitals, clinics, and mental health centers, affecting hundreds of thousands of workers. Lower productivity. Employees without health care may experience more sick days, reducing workforce effectiveness. Okay. 4. Increased financial hardship. Medical debts. Medical debt spikes. Families without Medicaid may struggle to afford medical care. Medical bills leading to bankruptcies. And financial instability. Higher tax rates, higher state taxes. Some states may raise taxes to compensate for lost federal Medicaid funding, affecting middle class families. Disproportionate impact on vulnerable groups. Okay, seniors and people with disabilities could lose essential home care services, forcing more people into nursing homes. Pregnant women and children may lose access to prenatal care, increasing infant mortality rates. Oh, God. Rural communities could lose hospitals, forcing residents to travel long distance for care, folks. See, I'm doing this show this afternoon. This is the extension of yesterday for everybody's FYI. Okay, next one. 6. Ripple down effect on social programs. Cuts to Medicaid could trigger Medicare reductions affecting seniors and people with disabilities. SNAP, food stamps, funding shifts could increase food insecurity, worsening poverty rates. Potential long term consequences. Critics argue that these cuts would worsen healthcare discrepancies, increasing poverty, and weaken the overall economy. Supporters claim the bill reduces government spending and economic and encourages workforce participation. Would you like to explore how individual states might respond to these cuts? The potential consequences of Medicaid cuts. Bill could be far reaching, affecting elections, party support, and legislative priorities. Impact on voter statements. Medicaid covers 1 in 5 Americans, including many voters. Cutting Medicaid could alienate working class voters, especially those who rely on the programs. Exit polls from 2024 showed a 15-point swing toward voters earning less than $50,000 annually. These voters lose health care. They may reconsider their support in future elections. Okay. Millions of voters in these states use Medicaid. If they lose coverage, it could shift election outcomes in Senate and presidential races. Congressional battles and protests. The bill has sparked intense debate in Congress, with Republicans arguing it reduces government spending and warning it harms low-income Americans. Protests erupt during congressional hearings, with 26 demonstrators arrested, including many in wheelchairs. State governments may push back against these cuts, leading to legal challenges and policy fights. Struggles for lawmakers. Medicaid heavy states may face backlash from constituents who lose coverage. Leaders argue the bill strengthens Medicaid for expectant mothers, children, and seniors, but critics say it prioritizes tax cuts over health care. Potential long-term effects. Medicaid cuts lead to hospitals closures and rural voters. A key Republican base could turn against the party. Democrats may use cuts as a campaign issue, framing framing them as harmful to working class Americans. Would you like to explore how individual states may respond to these cuts? Okay, guys, so I did that one for just an FYI for everybody. So I gave you guys some more information about that. Hope that helps people understand more what's going on with people's coverage and everything. So that's it for you today. And we'll see everybody for B in a little bit. For now, Gator Wellness. Take care, folks.